And there's a lot of book work to dental school. I mean, I'm having to learn biochemistry and right now I'm in pharmacokinetics and pharmacology, and I mean, it's crazy stuff about learning. I have to know everything about the cells and the proteins and all the different Krebs cycles and all that stuff, which you'll learn that in undergrad, but then you'll learn it again in dental school. And
their first summer, you had an entire biology class that you worked with at Cadaver.
Oh yeah. Oh yeah.
So that was really interesting too.
Yes.
But it's not all just about teeth as much as you would think.
Right. Well, because it connects your entire body. I mean, you think about, okay, let's think about, and this is one, people tell me all the time. They say, so you're in dental school, like what are you? And I was like, what year are you? I was like, well, I'm a second year. They're like, oh, so you're like almost done. You're like half a year from being done. I was like, no, it's not. I'm not. It's
4.
I'm not a PA. You know, like it's not a 2-year program. Yeah, it's a doctorate program. And so it's really interesting though, because you got to think about it. I mean, if this is my specialty, you know, let's say a podiatrist, somebody who works on the feet. You know, you think, well, they probably don't need another school to be a podiatrist. You know, like all you got to know is it's a foot. It's like maybe half of a cubic foot worth of information to learn about.
Yeah.
You know, and so, and you think this can't be that complicated, but you got to think about all the nerves that go into the foot and where do those nerves come from? And what if you damage a nerve down here, where are they going to feel it? What could that affect up higher? Same with blood vessels, because everything is like a tree. And so it's like, if you damage one of the blood vessels or you cauterize a blood vessel down here, where is that going to clot? How is that going to affect your upper leg? How is that going to affect your torso area? Could that even have any impact on your brain? You know, because everything's connected. All the different kinds of cell types. You have all these different proteins and tendons and muscles and cartilage, and you have all the different sort of cells that make your toenails. Do you know what kind of cells make your toenails? I don't either, you know, but a podiatrist does, I guarantee you. And so you got to know how to protect those. What if they have the ugliest feet in the world, they want nice feet, how are you going to give that to them? You know, you have to know how that treatment is going to impact the rest of the body. You know, how are you, all the warts and all the different sort of funguses and infections you can get in your foot. You know what? Hey, let's learn all the kinds of fungus and infection.
Wow.
Let's learn everything about those types of cells, and let's learn everything about the cells in your foot and see how those would interact. What kind of drugs would you give to get rid of those infections and those diseases? How would those affect the rest of your body? How would those affect your brain? We have to know how those affect your brain, you know, because you're a doctor after all. Like, you're prescribing medication, you better know this stuff.
Maybe, Nathan, you could tell us about some of your experiences in dental school so far. What are some of the highlights, maybe even some of the lowlights? What are some things that just make you even more excited about the field? Do you have any good stories, maybe?
You know, it's wild, because a lot of times I'm pretending to know what I'm doing. and that is, I mean, I think that, you know, you get out there for the first time with a patient, this is your patient, and you want them to think that you know what you're doing.
Yeah.
And that is, you know, and I'm doing it through the school, I'm not doing it on my own license, but that's a daunting thing, you know? And we just recently, we call it Stab Lab. And so I've got a partner that I chose, and me and him we're like buddies, like dental buddies for the rest of the next 2.5 years.
And you're in the same class.
Yeah, we're in the same class, and so we work on each other, starting these procedures and stuff like that. So we call it Stab Lab, and it is what you might imagine when they numb you up with, like, they got their needle, and when a dentist will numb you up for like a cavity or a root canal, or like to pull your tooth out or whatever. That's what they're going to do. They're going to numb you up with a local anesthetic injection.
So what better way to learn it than? So
we had to do it on each other, which makes sense. But I mean, you think about it, you're having somebody who's never done this before, ever, you know? And this, in my opinion, before I went to dental school, before I really, even up to this year, I was thinking this was like the most complex, sort of challenging technical part of dentistry was that needle, you know? And literally I got 2 weeks of classes on it. And then they just like, go out and do it. And they're like, watch this video, it tells you how to inject this person. And so it's crazy. It was like a 2-minute video. And I'm like, okay. And so I said, you know what, I'm gonna go, okay, I'll go first. You do it on me first. And so
you were the first victim? No,
sorry. I did it first. We did rock, paper, scissors. That's what happened. We did rock, paper, scissors. We did it 2 out of 3, best 2 out of 3, and whoever lost had to sit in the chair first. and I got to, and then the other person got to inject him, and I won. And so he laid back, and I had this needle, and it's crazy. I mean, it's like about that long, you know, and it's, you think that when they're, because what it feels like when you get an injection, it feels like they go in like, boop, and like just get right into the skin or right into the gums and just go, you know, just squeeze it out. That's what it feels like they're doing. But that's not what they're doing. You know, they are going
you're gonna
deep
scare people.
into, I mean, they'll flap you open like this. And they'll go up like this. And if they're doing, there's a couple different kinds that we call it. One of them is a block, where you get up to where the nerve exits from the face, and then it goes out into the teeth. So it's like,
it gets all the other ones.
Yeah, if you can imagine a tree branch, it's like the base of the tree branch, and then the tree branch goes like this, you know, as it goes out from the tree, and we're trying to get like the base of that tree branch in a block, because that'll block like half your mouth. And then there's another thing, and it's called a, I'm blanking on the name. I'll come back to it if I can remember. But, and so anyways, we did blocks on each other, and so you gotta go pretty deep. Infiltration is the other one.
So that one's just one spot?
Yeah, infiltration is just where you try to get up to the root, like the point of the root, and you just try to inject it there. But a block, you go deep, and so one of them, which you don't think about doing, one of the nerves comes out right of this bone right under your eye. And so you gotta go up all the way up and hit that. You wanna feel the needle hit the bone when you're doing this. And then you just, you know, you inject like half or 3/4 of a carpule of lidocaine. And so it was wild, because when I did that to him, I was just basically like, okay. and we didn't even have the oral surgeons weren't even over my shoulder. They were just kind of like around if you needed help. And so I'm like, okay, it's just right in front of the canine, and we're just gonna go up. And I was like, I've heard stories of people coming out of the cheek with this needle. And I was like, I'm not gonna do that.
Oh.
Don't wanna do that. And so you go in, and you're just slowly depositing anesthetic as you go, so you don't feel it, you know, going all the way up. And then I got to that point, and he goes, ah, because I hit the nerve with the needle as it came out. And what it feels like is you've just like licked it feels like you've licked like 10 9-volt batteries, you know, because he did it to me. Then when I was my turn, he did it to me. But, you know, and so it's just a shock. It's not like pain, even though it doesn't feel good, but it's like a shock. And so that was, I told the oral surgeon, I was like, hey, I think I just hit the nerve. He's like, oh, good, that means you're really accurate. And I was like, okay. So, you know, I deposited the anesthetic, and then, you know, within a couple minutes, his entire face, including the lower eyelid, was numb. And so he was blinking, he was like, you know, and it was really cool. It was so cool. It was so cool. And but then it was really interesting because then he did it to me, and because I knew what was happening, you'd think I'd be more scared because I knew all this stuff, but it was actually less, because I knew that the risk of him really hurting me was really low. And I knew that it wasn't as big of a deal, because when you don't understand something, it seems really scary because it's unknown. When I understood what's happening, it was a lot more comforting, even though it may sound horrifying.